Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
From St. Louis Public Radio. This is St. Louis on the Air.
I'm Sarah Fensky. Sleep apnea is a major cause of exhaustion in older adults, but a new study shows its effects go far beyond tiredness. It's actually correlated with dangerous driving. For every 8 breathing interruptions per hour, the odds of taking dangerous actions behind the wheel, like speeding or braking hard, increase by 27%. That means even mild sleep apnea can be a big problem. That's according to a new study published in the journal Sleep. Its senior co-author is Dr. Brendan Lucy. He's an associate professor of neurology and the director of Washington University's Sleep Medicine Center. And he joins us today. So, Dr. Lucy, welcome back.
Thank you very much, Sarah. It's a pleasure to be here.
So you study sleep, but for this study, you also had to study driving. You collected data on more than 100,000 driving trips among 96 older adult drivers. What sort of driving habits were you looking for in this data?
Well, we were looking to monitor the data from the car when individuals were driving it. My colleague Ganesh Babalal and his research group placed GPS data loggers in the cars that would continuously monitor information about speed of the car, hard braking, sudden acceleration. And using this data, they're able to create measures of aggressive driving or adverse driving behaviors. And these are what we looked at in this study.
And so you looked at their driving there, and then you're also trying to correlate that with their sleep habits. What kind of data were you looking at on the sleep end of things?
Well, these participants were enrolled in studies at the Knight Alzheimer's Disease Research Center at Washington University. And as part of their participation, they undergo multiple different study assessments. So there's groups that are looking at memory and thinking and performing standardized tests for those cognitive functions. And then we were looking at sleep, and we measured sleep via multiple ways. We asked questions and had participants answer questionnaires, such as how sleepy they were feeling. And we measured sleep using a device worn on the forehead that measures brainwave activity, and we can look at our individual sleeping, what stage of sleep they're in. And lastly, we used a home sleep apnea test device that measures the number of breathing events that participants had per hour. And this is a measure that we use to both diagnose and determine the severity of sleep apnea. And one thing I would point out about all of the participants in this study is they were 96 older adults, but they did not have any problems with memory or thinking. So these were cognitively unimpaired individuals that we were looking at. And all of these measures were being done simultaneously. So during the year that the driving was being monitored by Dr. Babalal's group, my group was measuring sleep over multiple nights.
And I want to bring it back to a detail that you mentioned on sleep. When you talk about breathing events, you're basically talking about breathing interruptions?
That's right. Sleep apnea is a sleep disorder where individuals have either obstruction or blockage of their airway, or the airway gets narrowed, or in some cases the airway's open, but they're just not moving the air. They're not breathing. And we look at how many times these are happening per hour. So everyone probably has, a handful of these events that may occur, 1 to 3 in a given night. But when it reaches the level of having 5 per hour, that's the threshold where we consider it to be abnormal. And 5 to 15 breathing events per hour is mild sleep apnea. 15 to 30 is moderate. And greater than 30 breathing events per hour is severe sleep apnea. And you can see how these could be quite disruptive to your sleep, because when it reaches the severe level, it's occurring at least every 2 minutes that you're having a breathing event.
Wow. So at that point, you're just not getting good sleep whatsoever.
That's right. It's very disruptive of the normal cycling through different sleep stages that we need to do. It can also increase your blood pressure in the middle of the night when usually it would drop down, increase the heart rate, and have numerous other problems.
So, what sort of correlation did you see between people who are having these bad night's sleeps, these apnea interruptions, and then how they're driving the next day?
So what we found was that as the number of breathing events per hour increased by 8, and that's I think a relatively small number given that you have to have 5 breathing events to be abnormal, and 5 to 15 is mild sleep apnea. So if someone had an increase from mild to moderate, that would likely be in this range that we're talking about. And if you had an increase of 8 breathing events per hour of sleep apnea, that led to, as you said in the introduction, about 1.7 times more likely to have an adverse driving event per trip. And we did monitor through this data logger that was plugged into the car over 100,000 trips. And so it's the likelihood of there being adverse driving behaviors such as that sudden acceleration, hard braking, is that much more likely. As your sleep apnea level increases.
And so did you control for people who might be just bad drivers to begin with?
No, unfortunately, we weren't able to do that. But we were able to control for numerous other factors. For instance, we looked at the level of sleep time or self-reported drowsiness that participants had. We controlled for age, sex, the level of Alzheimer's disease changes in the brain. And even after controlling for those factors, we still see this relationship. I think that the total sleep time and other sleep measures that we looked at didn't correlate because those would have been collected on, say, a single day or over a very few number of days during that year. Whereas sleep apnea is that level is likely to be sustained night after night and have potentially less variability than the sleep time may.
So what does this tell you as you sort of put these two grids together? You know, you're looking at issues with sleep apnea, you're looking at dangerous driving. Does this mean people with sleep apnea, even mild sleep apnea, are at real risk and potentially a risk to others on the road?
To me, the biggest implication of this is that there's a lot of treatment options for sleep apnea that are currently available. And if someone is suspected to have sleep apnea, if they were to be treated effectively, would that decrease the number of adverse driving behaviors that they would have, and then potentially decrease the number of motor vehicle accidents that they get in? Although that's not a question that we're able to directly answer in this study.
Sure.
And so if someone has mild sleep apnea, I would be less concerned and more thinking about it in a different way. Whereas someone has moderate to severe sleep apnea, if we treat them and we drop their number of breathing events per hour of sleep from 30 down to less than 5, are we going to make their driving that much safer? And I think that's an unanswered question, but it's a very exciting possibility because sleep apnea is a very treatable condition, and potentially we could increase the time that older adults are able to drive safely.
Well, that seems like a very good thing. I know older adults do not want to stop driving. And as you note in this study, it's actually not good for them to prematurely stop driving. That's correlated with problems of its own. Is that right?
That's correct. Premature stopping of driving in older adults is associated with bad health outcomes, and potentially it may be because it's a marker of problems like untreated sleep apnea or other health disorders, and the potential to treat something like sleep apnea that has there's a lot of options that are very effective, and to prolong independent driving, I think would be a really wonderful outcome down the road from this research.
We're talking today to Dr. Brendan Lucey. He's an associate professor of neurology and director of Washington University's Sleep Medicine Center, talking about just how dangerous untreated sleep apnea can be. And we want to hear from you. If you have questions about your sleep or you're wondering whether what you're dealing with might well be sleep apnea, Dr. Lucey is here to answer your questions. We're at 314-382-8255. That's 382-TALK. You can also send us a tweet at STL on air. So, Dr. Lucey, you mentioned that apnea is treatable. How easy is it to treat?
There's many different treatment options. The most common one is something called CPAP therapy, which is where you wear a mask and you breathe air at a higher pressure than the air around us. And this is very effective treatment, and most patients are able to tolerate it. There are some that have trouble. As you could imagine, you've slept a certain way your whole life, and now we're going to strap a mask onto your face and ask you to sleep with it on. I do like to point out to patients that it's a very natural treatment, because all that high air pressure is doing is keeping your airway open so that it doesn't narrow or collapse. There's no surgery, there's no drugs involved. But there are other alternatives, such as dental appliances that bring the lower jaw forward and open up the space in the back of the throat to allow air to passage and not be restricted. There's new therapies, such as a stimulator device that is implanted in the chest. This is obviously more invasive, but it detects when you breathe and it raises the palate in the back of the throat and sticks out the tongue to create more space in the airway. And so there's numerous treatments that can be performed. In some individuals, if they meet the right characteristics where it's very position dependent, even just sleeping on your side in a lateral position may be effective.
So there are treatments for this, and I know part of what you're here today is to encourage people to seek treatment if this is something they suffer from. Something that's interesting, you've said the percentage of older adults with mild sleep apnea is 30 to 50%. That seems really high. Is it possible there's a lot of people out there who are suffering from this and don't even realize it?
I think there are a lot of individuals who have sleep apnea and don't realize it. Mild sleep apnea is very common in older adults. The question about whether or not it needs to be treated is debated, mainly because we often treat individuals with mild sleep apnea if they have that finding plus something else, such as daytime sleepiness or problems with memory and thinking or problems with mood. And if they don't have any of those characteristics, patients may not come to medical attention. Usually becomes moderate or severe. There's more obvious signs, but it is very, very common, and I'm sure there's a number of individuals who are not currently being treated who are listening. I think that if there's any suspicion about problems with breathing while sleeping, such as loud snoring with long pauses in the snoring, or waking up gasping for breath, or that being observed by a bed partner, I would encourage them to speak to their physician about it.
Okay, those are a few good things to look for there. That loud snoring, waking up gasping for breath. If that's you, you may want to talk to your doctor. I'm going to go to the phone lines here. And just a reminder, those phone lines are open. You can call us at 314-382-8255. Again, that's 382-TALK, and share your questions for Dr. Lucey. Ralph is calling from Owensville, Missouri. Ralph, hi. You're on St. Louis on the Air.
Hi. I'm a Vietnam veteran, and I've since learned from other veterans in my age, which is 70 and up, that their doctors are asking them to get sleep apnea studies, and they think that there may be a connection between PTSD, sleep apnea, and AFib heart issues and I was wondering if you've worked with any military veterans that were in combat, and thank you.
Ralph, that's a great question there. Dr. Lucy, is that something you have any experience with?
I have some experience with that. First, I'd like to thank Ralph for his service, and I was on active duty in the United States Air Force for 4 years, and I had the opportunity to work with some individuals who were had been in combat situations and had PTSD. And sleep symptoms are really part of the core diagnostic features of PTSD, particularly insomnia, but also nightmares. So there's a number of sleep concerns that occur in individuals with post-traumatic stress disorder and are key to both making the diagnosis, that's what's going on, but also can really severely affect the treatment. I've even had patients who were referred for sleep apnea because they were waking up gasping for breath. And in working with them, we determined that they weren't waking up gasping for breath from sleep apnea, but because they were having nightmares and events related to their PTSD and to their combat experience. And so I think that it is a very important part of both diagnosing PTSD and also treating it.
So it sounds like if you have one, you want to look into this. You may find there's another, and it may be that one leads to the other and vice versa.
That's right. If you have poor sleep and you're suffering from PTSD, the potentially improving your sleep, could help with other aspects of the treatment. I think we can all agree that when we're not sleeping well, we may feel irritable. Certainly, I can attest to that. And if you have another disorder that is going on, like PTSD or depression, the poor sleep may magnify the effects that you have from those health problems.
I'm going to go back to the phone lines. Dennis is calling from O'Fallon. Dennis, hi. You're on St. Louis on the Air.
Hello. I had a sleep study done 2 years ago, and I showed as severe with 48 episodes an hour. And then a couple years later, I did another sleep study, and after I had the 48, I did use a CPAP machine. And then just this past winter, I had another sleep study, and it showed I only had 12 episodes an hour.
Wow.
Are the sleep studies consistent, or I haven't noticed any difference?
So, Dennis, you're saying you did do this treatment, and the study seems to suggest improvement, but that's something you haven't noticed. You're thinking maybe that it's not a consistent study.
Well, I'm wondering because, when I did the second sleep study, I wasn't using the CPAP machine.
Oh, okay. Interesting. Dr. Lucy, thoughts on that and what kind of consistency we might expect to see on this kind of thing?
I think there'd be a couple of questions that I would have. One is, the type of study that was being done. We're moving increasingly to home sleep testing where individuals wear the sleep monitoring devices at home, and those do measure the breathing events differently than when it's done in the lab, and there's more detailed monitoring. There can also be night-to-night variability, obviously, in the number of events that are recorded. Although 40 to 12 is a larger discrepancy than I would think. But sometimes intervening events, such as significant weight loss, can affect the number of events that individuals have per night. And lastly, I would say there can be a phenomenon where individuals who are treated with CPAP and then are tested off CPAP after a very short time being off of it, for instance, a day or two, where it does appear that the number of breathing events per hour is slightly, it may be decreased compared to what it is if you'd left them off CPAP for several weeks. And so without knowing more information, it's difficult for me to comment on exactly what was occurring in this particular instance. But there are reasons why the study may differ over time.
Okay. Well, Dennis, thank you for that question and for your call. We hope you continue to get better sleep. We also heard from Jonathan, who called in. He's happy to have this taken off the air. But he said that he was tested for sleep apnea. He's on a 4-month wait list for the CPAP device because of supply chain issues and recalls. Dr. Lucy, is that something that you've been aware of for your patients, that this, like everything else in the American economy, people might not be able to get these devices right away?
Yeah, this has been an enormous problem for almost a year now. Last June, there was a recall initiated on CPAP devices from one of the largest companies that makes them, Philips Respironics, and the machines were in the millions, and they have been trying to repair or replace those devices ever since. This process has been very long, and to my knowledge, they're not providing new machines to the market. They're trying to serve customers who had these devices, patients who had these devices and are affected, and that's really reduced the number that are being made because that's a huge. They had like 40% or some large percentage of the market share, and then that's been further hampered by the supply chain issues that have impacted so many other things that we buy, including that involve computer chips and the like. And so this has been an enormous problem and very frustrating for us as sleep providers, and also most importantly for our patients.
Yeah, I'm sorry to hear that. Sorry to hear that Jonathan's experience is not a unique one. And I know that, you're such a proselytizer for the importance of a good night's sleep. This is really part of what you want to leave us with today. From this study in particular and the work that you're doing on sleep apnea, just in our final minute here, what thought is it that you'd want to leave listeners with?
I think the main thought that I would want to leave listeners with is that if you suspect that you have a sleep disorder, to get that evaluated and treated, because it could have a lot of problems with your health or with your functioning, such as driving. And I think we mentioned some of the signs of sleep apnea to be on the lookout for: snoring and the waking up gasping. But if you feel like your sleep quality is poor and you're not able to undertake the tasks you like to do, the activities you like to do during the day because you're too drowsy, that also may be a good sign to drive you to sleep to speak with your doctor about your sleep problems and potentially get evaluated.
Well, Dr. Brendan Lucy, as always, we appreciate you sharing this information with us. Thank you.
Thank you so much for having me. It's been a pleasure.
This episode was produced by Emily Woodbury and Jane Mather-Glass, with audio engineering and podcast design by Aaron Dorr. Our executive producer is Alex Hoyer. St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri, St. Louis.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.